Good morning. Welcome, everyone. I think some people are still trickling in, but we're going to get started. My name is Lisa Held, and I will be your moderator for today's event. I'm a journalist, and for many years, I've been covering food policy, both the crafting of it and negotiations at the federal, state, and local level, but more often how food and agriculture policies impact people and communities on the ground. In the past, I've written for publications like the Washington Post and the Guardian, and currently I am the senior staff reporter at Civil Eats. So the purpose of today's event is to introduce and launch a series of 7 policy briefs created by New York Food 2025, which is a collaboration of the Lori M. Tisch Center for Food Education and Policy at Columbia University, the Hunter College NYC Food Policy Center, and the CUNY Urban Food Policy Institute. The policy brief series is titled New York Food 2025, Policy Recommendations for a Stronger, Healthier, More Just, and Sustainable Food System in New York City. And it was just released this morning, so you all are the first to get a peek at the series. The briefs are now available on nyfood2025.org under the tab that says Policy Briefs. And we're also going to include a link in the chat, so you'll have easy access to that. So as we all know, the pandemic has and will continue to have varied and lasting impacts on our food system. And these briefs build on an earlier report called New York Food 2020, Vision, Research, and Recommendations During COVID-19 and Beyond, which discuss the impact of the pandemic on New York City's food system and workforce. So I'm going to tell you a little bit about our agenda, and then we're going to dive right in. So first, we're going to hear directly from the collaborators involved in New York Food 2025 to learn more about the briefs. Then we'll bring in some guest panelists who have read the briefs to provide insights and feedback on the different recommendations. And then finally, we'll have some time at the end for Q&A. So you can submit your questions in the chat during the event, and at the end, we'll get to as many as we can before our time runs out. So let me just introduce our panelists, and then we'll get to the questions. So first, I have with me Katie Frazier, the Director of Evaluation at the CUNY Urban Food Policy Institute, Sarah Abiola, the Executive Director of the Lori M. Tisch Center for Food Education and Policy at Teachers College at Columbia University, and Ileana Garcia, the Deputy Director of Hunter College NYC Food Policy Center. So Katie, I'm going to ask you to kick us off. Could you share a little bit of the history of this project and why these 3 centers decided to work together on it over the last 2 years?
Thanks, Lisa. Our aim when this collaboration first began in March 2020 was to collectively monitor and assess New York City's food system response to the COVID-19 pandemic, and to gather and provide evidence to guide food policy and program decisions during the crisis. We knew when the pandemic began that government and philanthropy would largely be focused on meeting emergency needs, and rightly so. We believed our 3 centers could play an important role in assessing the impact and effectiveness of these responses, with an eye on both modifying relief efforts in a rapidly changing epidemic and meeting the moment to address underlying food system problems that preceded COVID-19. In 2020, prior to the pandemic, 1.2 million New Yorkers were experiencing food insecurity. The latest data from City Harvest suggests 1.5 million New Yorkers today are food insecure, a 36% increase from pre-pandemic levels. At the height of the pandemic in October 2020, 1 in 3 New Yorkers reported using emergency food services in the last 30 days. By March 2021, emergency food use decreased to 23% among New Yorkers overall, but remained high for Black New Yorkers, 38%, older adults, 28%, and people living in high poverty neighborhoods, 50%. During that same period, more than 1 in 4 Latinx adults and 1 in 5 Black adults in New York reported household food scarcity in the prior week, rates 4 to 6 times higher than among white New Yorkers. These statistics won't be surprising to many of you on the call, but they underline the fact that disparities persist and New York persists in needing food policies and programs that will address them. We released our first report in October of 2020 and have continued to work together over the last several months to monitor the effects of COVID policy implementation and to conduct research into food systems issues that we believe are central to building a more sustainable and just food system for New York City moving forward. New York City is in a different place now than in 2020, when state, and federal officials had to scramble to establish policies and programs to supply emergency food to feed hungry New Yorkers. We have 2 years of experience with these programs, and a number of great food systems innovations have emerged. Today, we want to highlight some of our key learnings from this period that emerged from our analysis of the impacts of COVID-19 on our food system, our monitoring of the recovery effort, and the need for a post-pandemic food policy making that builds on innovations from the crisis period. We offer recommendations that are really forged from the pandemic that we believe can contribute to a stronger, healthier, more resilient New York City food system in the coming years.
Great. Yeah. I mean, I think you talked a lot about how things have been changing so much, right? And now we're 2 years into the pandemic, and so much has happened in terms of New York's food system and policies. In February 2021, the Mayor's Office of Food Policy released the first ever food policy plan, Food Forward NYC. And now I think many of you on this call know that New York City has a new administration that has a lot of interest and focus on food policy. So these policy briefs are being released into kind of a new landscape, right, into that current landscape. Sarah, can you talk a little bit about how they contribute specifically to the current kind of landscape and policy conversation that's happening?
So sure. So as Katie mentioned, we have an initial report that was released in 2020 that was developed to address the state of emergency created by the pandemic and its impact on food systems and food security across the city. Unfortunately, many of the issues and disparities that were revealed to the public and policymakers at that time about the shortcomings of the city's food assistance programs and inability to effectively address food insecurity in certain communities still persist today. So these outstanding issues are why these briefs are needed as a resource to provide guidance for the next phase of policy innovation and implementation. Although we have made it through perhaps the worst stretch of the pandemic, we must continue to explore, promote, and implement policies that will create a more sustainable and health-promoting food system. So each brief explores a facet of the food system that should be addressed in both the short and long term from a policy perspective to promote sustainable access to high-quality foods. So for example, the goal of the first policy brief is to ensure that the city's food policies and programs reduce food insecurity for all NYC residents. At the onset of the COVID-19 pandemic, the city, state, and federal governments moved rapidly to bolster existing food benefit programs and to launch new food distribution methods. The city's response in particular had a number of different strategies. There was a $25 million investment in the city's food pantries, the establishment of a $50 million emergency food reserve, and the creation of Get Food NYC, which included the Department of Education Grab and Go meal program and the Emergency Food Home Delivered meal program. The $50 million emergency food reserve was transitioned to PFRED with the intent of providing direct food resources to pantries and community organizations across the city. However, in spite of these efforts, in its most recent food metrics report, the NYC Mayor's Office of Food Policy estimates that approximately 1.4 million NYC residents, or about 13%, are food insecure. This actually represents an increase in food insecurity since the start of the pandemic, as Katie pointed out. Moreover, Black and Latino residents of NYC experience food insecurity at disproportionately high rates. So there is still a significant need to expand and improve our systems of support to achieve greater levels of food security. Our recommendations in relation to this particular goal acknowledge the steps that have been taken while providing guidance to move forward more effectively. For example, we propose that the city work with state and federal agencies to continue to expand SNAP benefits to enable more individuals to purchase nutritionally adequate food in times of need, with a focus on minimally processed fruits, vegetables, and whole grains. We know that high levels of engagement in food benefit programs like SNAP among eligible populations during periods of non-crisis can be protected during periods of active crisis and its aftermath. In addition to expanding eligibility, increasing maximum SNAP benefits to households can increase program participation, increase household food resources for food purchases, and decrease food insecurity among very low income households. So in essence, food insecurity is just one major aspect of the NYC food system that we address in depth. The other policy briefs provide recommendations to solve other food systems problems based on what was done during the pandemic. So the policy recommendations are placed in context to connect existing policies with new policy directions. Taken together, these recommendations can lead to a more equitable food system that provides all New Yorkers with access to nutritious and culturally appropriate foods.
So there's still a lot of work that needs to be done, it sounds like. Ileana, can you tell us a little bit more about the structure of these briefs, the specific goals that you came up with, and especially how they connect to one another? We just heard Sarah say that, you know, it's not just about food insecurity. There's all these different aspects of the food system that need to be considered. So sort of walk us through these 7 briefs and how they all work together.
Sure. So as Sarah mentioned, each brief really focuses on a facet of the food system. There are a total of 7 policy briefs that are part of this larger series of recommendations that are being put forth by each of the 3 centers. And each policy brief really highlights a key policy issue or goal that we believe the mayor and city council should consider over the next 4 years in order to achieve this broader goal of building a stronger, healthier, more just and sustainable food system in New York City, and also includes concrete recommendations and action items on how to achieve that goal. And, you know, we really believe that New York City's food policies and programs must aim to collectively address the 7 issues that are highlighted in the briefs. I believe we dropped it in the chat, but if you go to newyorkfood2025.org, you'll see all of the policy briefs and the issues that we highlight and suggest that policies and programs tackle. And so that includes reducing food insecurity, improving healthy food access while also reducing the ubiquity of unhealthy food access in communities, promoting recovery, growth, and resiliency of the food economy, ensuring food workers' rights and protections, improving coordination and monitoring of food policy in New York City, and also increasing public control and ownership of the food system. We really urge policymakers to consider solutions to these issues collectively, right? Because they're so interconnected and so intertwined and can often fall short if just addressed in a silo. For example, as Sarah was mentioning, the first brief really focuses on reducing food insecurity in the city's emergency food policies that, you know, really can't solely do this by focusing on increasing the quantity or availability of food, which is really important. And we saw that issue highlighted particularly in the beginning of the pandemic, but emergency food policies must also ensure that foods are nutritious, that they're culturally appropriate, that they're accessible to all New Yorkers. Also, while it's important to improve healthy food access across settings, another parallel and important goal must be to reduce the availability and promotion and marketing of unhealthy foods and settings. And while we must promote policies that support the recovery and growth of food businesses, this must also be done with an eye and, you know, prioritizing the advancements of food workers' rights and protections. And so while each brief was really developed with a sort of laser focus on a particular topic, and that may be of interest to particular groups or stakeholders who are working in that space and kind of, you know, seek out that policy brief. But the issues highlighted in the brief are really interconnected and are intended to really build on each other. And so the strength of these briefs really lie in, I guess, the collective topics that they address. And so we really encourage policymakers and the public to read them as a series to really get the full kind of takeaway of these briefs. And then to make it easy to follow along, each policy brief follows the same structure when you go through them. So it starts with a specific goal that is highlighted that we believe the mayor and city council should consider over the next 4 years, followed by a brief background about the scope of the problem, particularly in the context of COVID, followed by a summary of existing policies and programs that already exist to address this issue and kind of how what we're suggesting ties in or builds on that, followed by 3 to 4 concrete policy recommendations that can be taken to achieve this highlighted goal. And then further, each recommendation section is broken down into a short-term policy recommendation that we believe should be a priority for this calendar year in 2022, then followed by additional recommendations to be worked on between now and 2025. So we're hoping that, that structure will allow people to kind of make the connections a little bit easier.
Sure. So you can kind of read through them and there's a uniform structure. And then also it's nice because you have these short-term goals, long-term goals, everything is laid out very clearly. And I think as we go through, we're going to kind of explore a little bit more about how the different goals connect to one another and how it's sort of all part of this bigger picture. But I want to kind of go a little deeper into some of these specific goals that you laid out. And I think kind of starting with the first goal, we've been talking so much about the pandemic, and I think all of us know and have seen that in a crisis, when it comes to feeding people as food insecurity rises, priorities often shift to just getting whatever food is available to people that need it as quickly as possible, right? And you all have laid out this goal of that even in a crisis, emergency food should be healthy, affordable, and culturally acceptable to New York residents. Sarah, can you talk a little bit about how that can happen? How can emergency food assistance programs provide nutritious and culturally inclusive food options even during a crisis? And why is that one of your key recommendations?
Absolutely. And this is a really important question, Lisa, so I appreciate it. I think that we have to be clear about why it's so important to kind of focus on cultural inclusivity. And I want to kind of look at it from the perspective of food security initially. So research has shown that a lack of cultural inclusivity in food offerings can be a barrier for certain populations that attempt to access food security programs like SNAP or WIC. So dietary restrictions related to cultural or religious beliefs may hinder an individual's ability to make use of food programs if inclusive options are not available. For example, there may be a lack of halal or kosher options. So in this sense, we know the kind of consequences of food security, especially during a pandemic. So trying to make sure that as many people as possible can use programs because they believe that there are options they can actually choose from to eat is really important. We all know that New York is home to people from a diverse range of cultures from all over the world. Immigrants comprise over a third of the city's population, so this is especially important in this context. The city's food policies and programs should strive to embrace and respect this diversity to eliminate barriers to increase food security. And there are a few different approaches that we recommend in this regard. So the Mayor's Office of Food Policy should consult with food pantries, the Office of Food and Nutrition Services at the New York City Department of Education, the Mayor's Office of Immigrant Affairs, other relevant agencies, and community-based organizations to gather community input on what is needed to ensure culturally inclusive food programs and policies at NYC. So we have to get the community engaged in the conversation. The city should support efforts of the NYC Department of Education to continue to expand the diversity of food options available in schools to be more inclusive of the variety of cultures in the city. And ultimately, we have to think about models of success when it comes to doing this type of inclusive work. The Food Ed Hub and the Food Ed Coalition, both housed in the Lori M. Tisch Food Center, are examples of how community organizations, school leaders, food policy advocates, program leaders, and other stakeholders can work together to ensure that all NYC residents and vulnerable populations have access to healthy and culturally responsive food. In relation to culturally inclusive options, we have to really be mindful of the nutritional profile of food assistance programs because it's just as important in terms of making sure populations have what they need during the pandemic and after. Nutritionally adequate foods not only help prevent chronic diet-related diseases, they also help protect people from facing serious complications from COVID-19 and other infectious diseases. So here's one thing that we think the city should do. Allocate additional funding for institutional kitchen infrastructure upgrades and professional development of kitchen staff. Having the skills and tools to prepare and safely store perishable foods is essential to increase freshly prepared and plant-based meals that are appealing in schools and in other institutional settings. Providing nutritious meals via ongoing food assistance programs, as well as during crisis-specific events, will improve the resiliency of NYC's food system and, most importantly, the overall health of the population. So when we talk about these issues, we're really trying to kind of stem kind of problems that arise when people don't have access to culturally appropriate food or food that has low nutritional value.
Yeah, and I think it's a really interesting time to be having this particular conversation in the context of policy. I think I saw at the federal level, Secretary Vilsack is going to be in New York this week talking about what the USDA is now calling nutrition security, which is exactly what you're talking about, right? Like going a step beyond food insecurity and actually presenting it as we have to also think about nutrition when we think about feeding people, right? And cultural inclusivity as well. So one of the recommendations that I think is the most interesting is to ensure a universal definition of healthy food used by all New York City agencies and emergency food programs. I know from my reporting that there's a lot of disagreement around what is and isn't healthy, even among nutritionists and health experts sometimes. So Ileana, can you talk about how this universal definition of healthy food can be created? And I know there are already New York City food standards in place. How is this different from what already exists?
Sure. Yeah. Thank you for the question, because I think it's a very important topic worthy of discussion, because we hear the term healthy food mentioned all the time, right? In the media, in government discussions, in academia, and even at the dinner table, likely. And the challenge really is that the term healthy food can have so many definitions. As you mentioned, it can mean different things to different stakeholders, even within a stakeholder group, within healthcare or across agencies who are setting policy. And so what we often see is that a central goal in food policy, particularly highlighted during COVID, is this goal of increasing access to healthy food, particularly in underserved communities and among underserved communities. However, the city lacks a universal definition for this term healthy food and its applied use across settings. And so to answer the second part of your question, the New York City food standards are very important and valuable. We actually advocate for their expansion in some of the other policy briefs that we'll likely get to talk about a little later. But what they do is provide nutritional standards for the over 230 million meals and snacks that are served in city agencies. And so again, they're very important. They focus primarily on the nutritional composition and preparation of the food, but don't necessarily provide guidance to help agencies prioritize or promote the consumption of whole foods that are minimally processed, which is also arguably a very important part of this equation when talking about healthy food. And so I feel like healthy food is really an umbrella term, but it's very important and very timely, particularly at this stage in the pandemic, to get more granular when we talk about healthy food goals in order to advance both public health and public policy in this area. And so one way to do this, we recommend that the city establish an advisory board composed of multidisciplinary public health experts, public policy experts, folks and organizations on the ground, doing this work day in and day out, including residents, to really work in tandem with the Department of Health, the Mayor's Office of Food Policy, to really develop a central definition of healthy food that really prioritizes minimally processed foods within New York City agencies and emergency food programs moving forward.
Sure. Yeah, that makes a lot of sense. I think one of the things that everyone agrees on when it comes to healthy is fresh produce, right? And I have this one example of New York City's Human Resources Administration recently announced a new procurement program that will require vendors to distribute fresh fruit and vegetables through the Emergency Food Assistance Program. Ileana, is that kind of policy? Are you looking for more policies like that, or are there other policy actions that are similar that would help ensure fresh food access in the emergency food system?
Sure. I guess, well, let me just start by saying that the procurement program is a really important step forward in improving the nutritional quality of food assistance programs. I think Sarah really highlighted, that earlier, like why that's important. And we know that the social and economic challenges presented by the pandemic really led to unprecedented increases in the use of the city's emergency food network. And, this really just wasn't a 2020 problem. As Katie mentioned earlier, these were existing underlying issues that now persist through the current stage of the pandemic, right? As close as 1 to 4 New Yorkers report using the emergency food system, with, even higher, numbers among certain groups. And so the reality is that many New Yorkers, rely on the emergency food assistance program either to supplement or help meet their family's food needs. And so the nutritional quality of the food that's being distributed is so important, right? And so I think the pandemic really helped to kind of spotlight the critical role of the emergency food network in our larger food system. And so to have a procurement program now that provides fresh fruits and vegetables to food pantries and soup kitchens is really critical and an important step moving forward. But moving forward, I think the city must now ensure that all participating food pantries and soup kitchens really have the necessary infrastructure, right? The infrastructure and the training that's going to be needed to integrate fresh fruits and vegetables into their programs moving forward. For many, a first and for the first time ever. And just personally, having worked in a hospital setting that distributed fresh fruits and vegetables kind of prior to this, I can tell you how much goes into fresh fruit procurement. Sites must have the proper refrigeration and storage, right? Just that infrastructure of how you're going to house the food is really important. Staff must have the proper food safety training and certifications and systems and protocols in place for how you're going to monitor and rotate fresh foods. You have to really understand your volumes in order to procure the right amount of food on a weekly basis. And even then, that's going to ebb and flow, right? So how are you going to handle and minimize food waste? And what's the processes that are going to be in place for that? So there's a lot of kind of an infrastructure and information that needs to sort of be gathered in order for sites to really do this effectively and integrate this into their programs. And so that's really why our short-term recommendation for 2022 in this policy brief is to increase funding and technical assistance to emergency food programs for both infrastructure updates and training to support fresh food procurement. And so moving forward, it's going to be really important to assess the emergency food network's capacity for the distribution of fresh fruits and vegetables. And so, we recommend starting with a capacity assessment to really understand what infrastructure sites currently have, what is needed, what is the staffing capacity and sort of knowledge and training that's needed to really help inform future budgeting and allocations to really ensure that this is a sustainable program moving forward.
Yeah, that makes sense. And I mean, even that you're talking about specifically about the emergency food system, but I know that those infrastructure issues are a barrier in a lot of food programs in New York, like school food, for example. In terms of getting more fresh food into schools, it can be really difficult for schools that don't have kitchens that can accommodate scratch cooking, right? Or increases the need for labor, so you need more people, and so all those other things have to be in place. It makes a lot of sense. So we've been talking a lot about healthy food, and goal 3 is kind of focused a little more on unhealthy food. So the goal says to reduce promotion and ubiquity of unhealthy food in all community, institutional, and retail settings. So Katie, I'd love to hear from you about what role policy can and should play in making unhealthy food less available and desirable, and why is it important to also kind of hit that flip side and not just make more healthy food available, but also tackle this unhealthy food?
Thanks, Lisa. I love how Ileana set us up talking about kind of the duality of these goals, because that flip side is really important. We know that the individual health consequences of COVID-19 were more severe for those with underlying health conditions, diabetes, obesity, diet-related cardiovascular disease. And that's really thanks in a large part to the status quo of our nation's food system. The proportion of the population with those conditions is really quite high. 16 states now have obesity rates above 35%. The national obesity prevalence is around 42%. That's obesity, not even including kind of the overweight category. 11% of Americans live with diabetes, and 1 in every 4 deaths in the US is linked to heart disease. That's, I work in this field every day, and those numbers still are astounding to me. There's a tremendous amount of research documenting the ways in which diets high in calories, unhealthy fats, salt, and sugar are contributing to premature death and preventable illness from diet-related disease. Consumption of highly processed food is replacing tobacco as the leading preventable cause of illness and death. And this is true in New York City, across the US, and globally. And we know that the diseases associated with unhealthy diets, diabetes, cancers, high blood pressure, heart disease, play a major role in driving health inequities and worse health outcomes for New York City's Black and Latinx populations compared to whites. We fully endorse efforts to increase access to healthy food, as well as efforts to educate New Yorkers on how to choose and consume healthy foods. Those are all really important, very good things. But we know that those policies, won't fully be successful without policies that limit the power of food corporations to create unhealthy food environments and promote ultra-processed food and beverages. Without those, we aren't fully addressing the root cause of diet-related disease. In brief number 3, we build on our pre-pandemic work on policy options to reduce the predatory marketing of unhealthy foods and beverages in New York City. And we argue for policies that build on Executive Order 9 and S7487A, New York State Senate's proposed Prevention of Predatory Marketing Act. We're so excited about that. And it really aim to regulate and restrict the promotion of unhealthy food in public facilities, expand efforts to support voluntary adoption of the New York City food standards in new community settings, and provide incentives to food retailers and food service establishments who prohibit advertisements for unhealthy food and beverages. We argue that taking these steps now can go a very long way in creating a healthier food environment for New Yorkers and setting our food system up to be more resilient in the face of future crises.
Great, thanks, Katie. I want to talk about Goal 4, which emphasizes the need for recovery, growth, and support of New York City's food infrastructure and economy. So we know, for example, that in the worst days of the pandemic, restaurants were some of the businesses most impacted by shutdowns, which also impacts the workers who work at those restaurants. And that is a continuing issue that certainly has not gone away. Ileana, can you share more about how the pandemic impacted the local food economy in the city and how the recommendations in these briefs address those issues?
Sure. As you mentioned, or was mentioned earlier, a lot was really done by the city in the early days of the pandemic, both to monitor and help protect the food supply chain. The city established that $50 million emergency food reserve fund, as Sarah mentioned, that was then transitioned to PFRED to help provide direct food resources to pantries and community organizations. But at the retail level, the pandemic really shifted food purchasing habits and behaviors. And, we saw this, and it was really kind of highlighted and documented in our earlier report in 2020. But we saw decreases in restaurants and institutional spending and increases in spending in, food retail and grocery, particularly in direct sales at farmers markets. We saw supply chain shortages as food retailers really adjusted to, these shifting demands. We saw reports of farmers having to get rid of products as the restaurants and the institutional settings and those markets that they relied on either weren't there anymore or were, drastically reduced due to the shutdowns. And then kind of part of that bigger equation too is New York City's Hunts Point Distribution Center, which is a really key component of our food system. Close to 4.5 billion pounds of food passes through the distribution center kind of into channels in New York City. So that's also a really kind of critical part of the city's infrastructure. But we know that having a concentrated reliance on sort of one area can lead to supply chain interruptions if there were any vulnerabilities to impact the distribution center, including natural disasters. We saw that with Hurricane Sandy, right? But even in the context of COVID with employment shortages and staffing issues, so that can have, a ripple effect in terms of the food supply chain in New York City. And so I guess just with these things in mind as kind of background and context, Policy Brief 4 was developed to really focus on recommendations to promote recovery, growth, and resiliency of New York City's food infrastructure. And so we advocate for policies in a few areas. The first is to support food infrastructure improvements at the community level throughout the 5 boroughs. And so this includes things like increasing assistance to increase the number of food retailers who accept SNAP and EBT, wireless EBT, especially among small and independent businesses. Also expanding and creating incentives and accountability to purchase local and regional products and produce, particularly by New York City agencies, and also advocating for the continued investment into the Hunts Point Distribution Center. I think there's been a lot of that sort of over the past decade or so, but continuing to really shore up and strengthen that hub, which is really critical to the way that food flows in New York City. So just a few, I guess, examples.
Yeah, absolutely. No, that there's a lot there. And goal 5 is about workers. We haven't really talked about food workers yet. So the goal is to sort of ensure all food workers have safe working conditions and the right to organize, as well as sufficient pay and benefits. I think, during the pandemic, the media has really highlighted the plight of food workers. You all have talked about how a lot of those issues have been around for a long time before, right? But kind of got more attention over the last few years. There have been a number of policies implemented by the New York City Council in the last year to support food delivery workers specifically. But I think, we all know there's a lot more that could be done. Katie, what do you see as important next steps for the city to continue to support the food labor force?
Thanks, Lisa. This is one of those moments where I regret that we're on Zoom rather than in a large conference room together, because if we were, I'd be asking the audience for a show of hands, how many of us increased our food delivery during the pandemic? I know my hand would definitely be up. My guess is that many of yours would be as well. Pandemic food delivery, it skyrocketed, expanded dramatically with more people eating at home, an increased public desire to avoid grocery stores, and the expansion of these app-based platforms to meet increased delivery demand. These platforms provide low wages and generally poor working conditions for delivery workers. As you said, it's been highlighted in the media loads. And while poor working conditions have long existed for grocery and fast food workers, there's been this increased focus of late. And so we think this is a really key moment. There are several brilliant organizations who are leading the charge in organizing food workers to advocate for better working conditions. And we believe that organizing and advocacy must continue. We also believe that the city labor laws, policies, and enforcement policies can be improved and expanded to better protect food workers and other low-wage workers as well. And we think that consulting with labor unions, worker centers, and other worker organizations to elicit their proposals for ways of doing this is an important first step that the city can take to increase support to the food labor force. We conducted a survey last year of over 100 New York City food workers who had worked during the pandemic. And we found that food workers who belong to unions were more likely to have health insurance, paid sick time, and other critical benefits and protections than their non-unionized peers. efforts to protect and expand workers' right to organize, for example, by explicitly granting third-party and app-based food delivery workers the right to organize, something they don't now have because of how they're kind of classified as workers, is critical to advancing fair labor standards within New York City's food system. And the New York State Department of Labor, they're mandated to protect the basic rights of all workers, and New York City goes beyond these protections with specific sick time, wage, fair work week, and just cause laws designed to protect the food workforce. However, we know that the burden of reporting food labor violations currently falls on the food workers themselves, and that often results in hazards going unreported, in part due to worker fear of retaliation from their employers. They don't want to lose that lifeline to income. So to help shift the burden from the shoulders of food workers, we're advocating for increased resources to agencies to improve monitoring and enforcement of current labor laws, and for annual public reports on compliance. My colleagues, Emma Vignola and Nick Frudenberg, are deeply involved in our institute's food labor focused work, and I'm sure would be thrilled to speak with anyone in the audience who wants to discuss ways that we can continue to advocate for this work together.
Absolutely, and I'm glad you brought up unionization. I just reported a story for Civil Eats a couple of weeks ago about how since the pandemic, there's been this incredible swell of union organizing among food workers specifically. And one of the big examples was in New York State, where the state finally granted the right to unionize to farm workers. And the first farm worker union in New York was certified on Long Island at a vineyard. So I think we're going to see a lot more of that moving forward, it seems like. We've been talking about all these different goals, and I think Ileana, at the beginning, you kind of set up this idea that they're all connected and they can't kind of work on their own. Goal 6 addresses creating integrated structures, processes, and systems. So how these goals connect to each other, how these structures work together. Sarah, can you tell us a little bit more about how to achieve that integration? Like, is there practical guidance in the brief that would help New York City kind of achieve that level of integration?
Yeah, Lisa, we decided to tackle a really big question with this one in this particular goal. So I'm going to try to unpack this in the time that we have, but it's something that certainly has to be kind of considered as a very long-term aspiration. So I want to start by just kind of talking about the ways in which there's this kind of pattern of dealing with food policy questions across the city. So within the city alone, the NYC Department of Social Services, the Department of Mental Health, Department of Health and Mental Hygiene, the Department of Education, the Department for the Aging, Department of Homeless Services, and the Department of Youth and Community Development are just a few of the NYC agencies that play a key role in food policies and programs. So you can imagine that this is quite difficult for any individual to navigate. And New York City is not unique in the way its food policies span multiple agencies, nor in the need to improve interagency coordination. So many cities are moving towards more interagency collaboration by drafting comprehensive plans for short and long-term policy goals that recognize the need to involve diverse city, county, and state agencies. So this is critical, not just for New York, but it's a critical issue for all cities, because bureaucratic barriers to accessing services at the individual level can diminish program participation and efficacy. So this is especially alarming when the pandemic has forced many NYC residents to rely more heavily, and some for the very first time, on the emergency food system. So enhanced agency coordination truly represents an opportunity to address not only food security issues, but also other major social determinants of health in a comprehensive way. So how do we go about doing this was the question, Lisa, and there have been some steps in the right direction when it comes to integration of city food policies and systems. So first, the Mayor's Office of Food Policy was codified in February 2020, and it works to increase food security, promote access to and awareness of healthy food, and support economic opportunity and environmental sustainability in the food system. Its duties include publishing an annual city food metrics report, managing an interagency food task force, and coordinating emergency food capacity. In the annual City Food Metrics Report, the 10 NYC agencies that routinely purchase and serve institutional meals publish the number of meals and snacks they serve and document their compliance with certain NYC food standards, which allows stakeholders to monitor annual trends. So this is a great kind of step towards bringing many different agencies together and having a conversation about what they're doing. At the same time, this work requires resources that aren't actually readily available to the Mayor's Office of Food Policy. So although they've worked diligently to achieve these goals, they've been inadequately funded to fulfill their mission and expand the work across more agencies. So we'll get to what that means in terms of recommendations in a moment. Another step in the right direction was the release of Food Forward NYC, as you mentioned earlier, a 10-year policy plan in February 2021, which draws from prior city food plans and sets many goals, including strengthening cross-sector coordination around the development and implementation of food policy. So going forward, what do we do specifically? I think we have to look at this from a long-term perspective and examine the way in which you kind of bring organizations together. So we suggest that the city expand the budget and staff for the Mayor's Office of Food Policy to formalize the ties that were created across agencies during the COVID-19 crisis. So we had this emergency response, many organizations came together, many agencies came together rather, and we need to really solidify those connections, and that typically requires resources, both human and financial. The city should allocate funds to audit current programs to provide guidance on cross-agency monitoring efforts going forward. So again, we need to determine what's working and how that can be implemented and really kind of maintained from a policy standpoint. Finally, the Mayor's Office of Food Policy should be involved in city efforts to integrate and consolidate the social services application process via Mayor Adams' proposed My City portal, which should be done in collaboration with nonprofit organizations whose mission actually is to increase outreach and facilitate enrollment in such programs. So we must really bring a lot of players into the fold, but ultimately we need the city to invest in kind of integration and to bring those kind of players to the table who have the expertise and the community connections to make the agency's work even easier.
Great. So we're on our last goal. Goal 7 is to invest in strategies to increase power, control, and ownership of New York City's food system by city residents and communities. Katie, can you talk about what does that really mean to increase community power, control, and ownership on the ground? How can New Yorkers more actively participate in food democracy, and do they want to?
Great question, Lisa. Thank you. Sarah raised just how complex and bureaucratic navigating food policy in New York City can be, even for people working in the policy space. And this brief is really about helping New York City residents understand how to get involved. In writing about this topic, we found it really helpful to clearly define 3 terms related to food democracy: power, control, and ownership. Power being the ability to influence food policy outcomes, both through formal means like the public review process and informal mechanisms like political activism. Control is the ability to make decisions about issues affecting residents through mechanisms like community board approval, allocation of city budgets through participatory budgeting, and resident-led conversion of empty lots into urban farms. And finally, ownership means that residents own aspects of the food system, such as community-owned gardens or worker-owned food businesses. Ownership can also refer to private ownership for the public good, nonprofits or operating community kitchens and emergency food facilities. The pandemic demonstrated the importance of local power to implement solutions and influence city-led recovery efforts. In order to increase this power so that in future crises we have an established, active, and engaged system for food democracy, we need to increase awareness about the ways in which New Yorkers can participate and lower the barriers to that participation at baseline. So to your question of do New Yorkers want to? I think they do, but maybe they don't know that they do quite yet, or they do, but they don't know how to quite overcome some of those barriers. So one of the recommendations we put forward in this brief is to expand and support training and educational programs in schools, community organizations, and higher education to prepare New York City's young people and community leaders to be effective advocates for food justice and food equity. And again, there are some terrific organizations already doing this, and we're advocating for the expansion of that. We also argue for increased support for community organizations to develop and implement local community food plans, building on the momentum of the city's 10-year food plan, Food Forward NYC. Because so many elements of the food system are based on land use and budget decisions made at the community level, for example, location of grocery stores, fast food restaurants, outdoor food advertising, and so on, community-based food plans developed by or in conversation with community boards can engage New Yorkers in developing strategies tailored to the unique circumstances of their communities. On an individual level, I'd encourage everyone to look into getting involved in participatory budgeting activities in their district and to reach out to their city council members to communicate about food policy that is important to them. The city council website has a really helpful section on how to get involved in the participatory budgeting process. I'll drop a link in the chat now, but it's just one way I think that folks can dip their toe in if they're interested and read the brief to also learn more.
Great, thank you so much. Katie, Ileana, Sarah, thank you for all of those insights. I think everybody can see that a lot of work went into developing these briefs, and this was a really great exploration of some of the recommendations. We are going to now move to our outside experts who work within the food system and New York City communities and have insights into what food policy looks like on the ground. And I'm going to talk to them about how they think these briefs apply to what they're seeing and what their vision for the future of food policy in New York City looks like. So I'm going to introduce these guest panelists. With us is Gabrielle Blavatsky, the co-founder and policy director at Equity Advocates, an organization that works to address the underlying causes of food inequity in New York through policy and systems change. Gabrielle is a policy analyst with experience working on local, state, and federal nutrition, public health, and agriculture issues. I also have Mark Levine, the Manhattan Borough President, who previously served 8 years in the New York City Council, representing parts of Upper Manhattan, where he was a leading voice for tenants' rights, public health, and equity. And Maritza Owens, who recently stepped down as founder and chief executive officer of Harvest Home Farmers Market, a pioneer in bringing farmers markets to low-income New York City neighborhoods, and one of the city's largest managers of farmers markets in communities of color. So you all three of you are working in the food system and policy from different angles. So I'm going to ask a few questions, and I'd just like each of you to answer the same questions in terms of how it applies specifically to your work. And we just got word, I think, that our Manhattan Borough President is going to have to jet in a few minutes. So I'm going to start with Mark. So the first question is just, which of the policy ideas in these 7 briefs really stood out to you as the most exciting in terms of both their potential for impact and feasibility? Like, can they really be done?
Well, thank you, Lisa. This has been already such an incredible discussion. My goodness, Catherine and Ileana and Sarah were amazing. Could have listened to them all day. And I think that these reports offer something really important to policymakers in the city. They're going to be a huge resource to my team. So grateful to everyone who worked on them. Grateful to CUNY and my friend Nick Freudenberg for continuing to lead on this. You know, I had the chance to speak to this conference or a similar version of it a couple times in recent years, all pre-pandemic. And I think that every reason that we cited for why this work is important pre-pandemic is now even more urgent as we're coming out of this. It's quite clear that one of the main drivers of inequality in this pandemic was the extent to which unequal access to healthy food led to increased incidence of the top conditions that make someone vulnerable to COVID: hypertension, diabetes, obesity. All of them are directly related to access to healthy food. And we have got to learn from this crisis, and we've got to come out of this with a renewed commitment to address it, so that when we hit the next pandemic, and we should assume there will be one, that we are better equipped as a society to avoid this inequality. There's so much in what you have produced that I think would help us achieve that goal. Look, obviously we have to fix the retail landscape. We need non-traditional access to food and things like farmers markets. We have to improve the food that the city is serving people in lunchrooms and elsewhere. But I was really heartened to see the extent to which you focused on urban agriculture, because I think that this is an area where city government has a major role. Obviously, the benefits of urban agriculture are manifold. It's not only about improving our physical health, but it provides incredible experiences to young people that can really open up new careers and new ways of looking at the world if they are involved in cultivating the food, as they are in many of the best programs. There's also myriad environmental benefits as well, excuse me. But many of the places where we have, I think, the biggest upside to expand urban agriculture are on publicly owned land. So it is NYCHA campuses, which have a lot of open space, and residents who are really excited to be part of the green revolution, but need support from us to help create more community gardens where they can grow healthy food. School campuses, both school grounds and school rooftops, where young people can be involved in cultivating, and as I said, learn from that experience. And then there's a network of hundreds, I think close to 400 community gardens in New York City that are the obvious place to go bigger on urban agriculture, but they really suffer from a lack of investment and resources from the Parks Department and city government more broadly. So we really need to double down on investment in those spaces. I love your suggestion of creating a mayor's office of urban agriculture to coordinate this across multiple agencies. I just mentioned several: NYCHA, Department of Education, Parks Department, right there, that need to be coordinated in this effort. I'll also mention how much I appreciated the extent to which you focused on elevating the voice of young people, which are a source of expertise that too often are ignored. And on food, among other things, they are major consumers. And as we're moving to, for example, try to make school menus healthier and try to pivot to more plant-based options, which I strongly support, I do worry that the voice of young people is not being heard enough. And if young people don't eat the healthy food we served, then the whole effort was pointless. So we need to consult young people in how we craft menus and design the environments in which food is served. So I love the idea of creating a permanent youth food advisory commission that would have official sanctioned by the city, but could be composed of people recommended by groups on the ground who are doing this work on the front line, groups like Harlem Grown, groups like Green Bronx Machine, that are already working with young people and could be the vehicles by which young people are nominated onto this kind of advisory body. Finally, I want to tell you how gratified I am by the extent to which you have focused on the workforce. I've been in a lot of discussions of food policy where workers were not front and center or even ignored. And so I'm really gratified by the way that you have put this front and center. Many of the major policy efforts of the City Council, which I think it might have been Ileana who highlighted that, have been focused on this workforce through to today, really over several years. The fast food sector in particular has been really often abusing low-wage workers by just horrible scheduling systems that give people little notice on their work schedule, by requiring them to stay late and open up sometimes with only 4 hours of sleep in between, and of course underpaying and lack of protection. So So I've actually been very active in the fight against Chipotle, which has been a particularly bad actor. But you identified unionization as a solution, and it is in any sector, but quite powerfully so in the food sector, where union and protection can ensure fair scheduling, fair wages, and fair worker conditions. And I think I'm probably over time, but certainly for food delivery workers, there's a lot we have to do to make their conditions safer and fairer. Some of the bills we passed last year are now coming into effect now, which will help on that front, but there's more work to do. So I'm going to pause there. I'm really grateful to be part of this discussion. Apologies that I might not be able to stay for this full section. It's just a very, very busy day of back-to-back events for me, but I'm all in on this fight. Really want to make sure we serve as a resource and partner for all of you in what I consider to be one of the most important policy efforts coming out of this pandemic, bar none. Thank you so much.
Thanks, Mark. I gave you a little extra time because I knew you might have to jump off. So thank you so much for those insights. I would love to now hear from Maritza and Gabrielle. Maritza, if you want to start, which of the policy ideas in these briefs stood out to you as really exciting in terms of potential and feasibility? I think you're on mute.
I'm technically challenged, so forgive me.
We all do it.
So thank you for this opportunity. I think this was a great exercise in reviewing all of the policies and giving us an opportunity to provide input. I think after reading all of the policies, the one that stood up to me the most was the coordination of services across agencies and across the city. I think that has been something that has been much needed, and as programs continue to grow and expand, and I think in the pandemic, we really saw that that was one of the issues that came to fore, that we had to quickly pivot and spin around and figure out how to work together to address food insecurity across the city during the last 2 years that we were, dealing with the pandemic. My major concern with some of the policies are that they are very demand-based, but not supply-based. And as someone who's been involved in farmers markets, and I've had the privilege of speaking to farmers for over 20 years, I feel that we somehow always seem to leave the farmers out of the conversation. And particularly as a result of the pandemic, supply chain concerns will continue to exist unless we address our local food security issues in the state, in our region, I would say, because we don't seem to incorporate farmers. Farmers were reliant on the importing laborers for work, which created bottlenecks for them because many of them were concerned that they wouldn't be able to till their crops. We found that production costs increased. Many of the policies address workers' rights, which are very needed, but those also impact the production of products because then the costs go up for them as well. So until we kind of look at both sides of the equation, the supply side and the demand side, I think that we will not be able to have a balanced, addressing balanced food insecurity across all sectors.
I'm really glad you brought that up. I had a question about that too, and I think I would like to pose that to the larger group once we're finished with this section, because that is sort of, to me, it was the one thing we haven't really talked about, right? The rest of the supply chain and how these goals impact the process, workers in processing plants, and all the way back to the farms, and we're trying to make sure everything's integrated in the city policy, but then there's this whole other world that is where the food actually is coming from, right? So, yeah. So I definitely want to talk more about. Sorry, go ahead.
The other thing that concerned me was, increasing enrollment in SNAP. I mean, SNAP is a very, very valuable program, and many of our farmers and farmers markets would not survive without it. But unless we also look at what the requirements for enrolling in SNAP, and we don't increase the enrollment requirement for SNAP, most of the families are on SNAP already living below the poverty level. So enrolling more people in SNAP without increasing or I would say raising the threshold for people to be able to be eligible for SNAP, we're not really going to be able. $39,000 for a family of 4 to be eligible for SNAP. That's not enough money. So you're leaving out a lot of people who would be probably can use SNAP but cannot participate because they're making $41,000 a year. And so they are still food insecure at that level of income, but they're not able to access SNAP. So that, again, is one of the concerns that I had when I look at the policy. I was like, okay, yes, we're basically increasing the enrollment and putting people on more, increasing the enrollment in SNAP and making people more dependent on a food subsidy, that they're already below the threshold for poverty, that they're going to maintain that level unless something is done to change that. So we're not really changing the landscape by increasing SNAP enrollment without addressing SNAP requirements to become eligible for SNAP.
Great. Gabrielle, I want to give you a chance to weigh in. What stood out to you within these recommendations?
Yeah, thank you. And thank you to the CUNY, Tish, and Hunter team for inviting me here today. I think to me, there were 2 things that really stood out, and it's related to something Dr. Abiola was talking about. And the first, to me, and the absolutely most important recommendation in these briefs that I think is really feasible and has the potential for the biggest impact is the very first one in the very first report, which recommends funding for the Mayor's Office of Food Policy to appoint a team to conduct a thorough trans-agency assessment of food programs that were deployed during COVID, and then develop a preparedness plan based on that assessment. Because without this data and this evaluation of the programs that were set up during COVID by the Biden administration and the Food Czar team to respond to the hunger crisis that was created by the pandemic, it's really difficult to understand truly the full impact of the pandemic on our food system and other systems as well, and impacted communities, or to really make the best, most informed policy recommendations that are possible for what the city should be doing going forward. We really need that information about what happened. And Equity Advocates, my organization, in partnership with the New York City Food Policy Alliance that we facilitate, for the better part of a year, really did try to get both raw data on the COVID food program set up by the administration, as well as an analysis and evaluation of those programs about a year into the pandemic when they were ready for re-upping during the last budget cycle from the de Blasio administration. And unfortunately, we weren't really able to get that data that we requested. We even worked for months with staff of the General Welfare Committee to plan an oversight hearing at City Council to get this data from the administration. And unfortunately, that effort, that hearing was canceled at the very last minute, and we're still working to try to get it rescheduled. But as far as I know, the only data that's really publicly available right now, what happened during under these food programs during COVID is, zip codes in 2020 on where those meals were served, what kinds of meals they were, like kosher, vegetarian, halal, some info about the city vendors that worked with, and really it's data that's focused on total poundage moved and total meals served of those under those programs. But there's so much more that we want to know, that we should know about what did and didn't work with those programs, how equitable the city's food response was, where things broke down, where things could have been better, what worked super well, how different neighborhoods were served and impacted, and what the needs were in different neighborhoods. And for right now, a lot of what we have is just kind of anecdotal evidence and anecdotal information from community members and nonprofits that were serving people during this time. So we need more. And, to be fair, the Mayor's Office of Food Policy, the Food Czar team, the administration was under a lot of pressure to, feed people at this time. It was a crisis. But and they had very little capacity, right? They're setting up these programs overnight. But now we're out of crisis mode, right? And so that's why I think the second recommendation that really stood out to me is, making sure that the city allocates resources to making the Mayor's Office of Food Policy larger, giving it more capacity, more staff to do this type of data analysis, really expand its budget, turn it into a true food czar role that I think would formalize these cross-agency ties that we're talking about that are so important to integrate that work, and really set up this community liaison position that's called for in these series of reports to make sure that community input, CBO input into the programs that the Mayor's Office of Food Policy is setting up or may set up in the future is really informed by community and expertise on the ground about what's working and what's not, so that we can, continue to learn from and build on these programs going forward and really do the best work that we can.
Great, thank you. So we're going to actually shift to the audience questions, but I think Gabrielle and Maritza, thank you so much for your insights, and we're going to continue to talk to you via this next round of questions and bring everybody else back in. And actually, I think two things that just came up in our discussion, other people are putting questions in the chat that relate, so I think we can kind of continue to discuss two of these topics as we go. And just a reminder to everyone in the audience, we do have some questions already that we're going to spend some time on, but you can continue to submit them in the chat and we'll try to get to as many of those as possible. So I just want to make sure we have Sarah, Katie, and Ileana back in. All right, everybody's back. Great. So let's start with these two questions that kind of were percolating in this discussion with Gabrielle and Maritza. First, one is about resources and budget, which a lot of people have questions about, and then but let's start with this question about farms and producers. As I said, this was kind of a question that started percolating for me as I read through the briefs, especially because New York City is a massive consumer of food, but the majority of the production, farming, processing occurs outside of the 5 boroughs. Although we were also talking about urban agriculture, which is an exciting area. But, I wanted to hear a little bit about what you all think about as policymakers think about these big goals like reducing hunger, increasing equity. How do we make sure that those are being met along the supply chain, all the way back to the farms that the food comes from? Who wants to jump in?
Sure, happy to jump in a little bit about that, because we touch on that a bit in policy brief 4, as well as just in the earlier report from 2020, which is the importance of taking a more regional approach to our food system when really crafting food policy in New York City. And I think a few examples, thinking of the Nourish New York program is a really great example of, a program that came out of the pandemic, really with the intent to support both the regional food system by connecting, farmers and surplus agricultural supply to the emergency food network. This was, an emergency food system that then, food program rather, that was then signed into law recently, I think in November. And, I think this is a really important program. We advocate for really creating and strengthening incentives for participation in this program by the emergency food network, especially kind of smaller, less resourced food pantries and soup kitchens that will essentially help to, expand the market and kind of diversify the market for farmers. I think, the Good Food Purchasing Program is also another really critical procurement strategy that the city participates in, and the mayor's, recent executive order just codified that program, but really works to increase transparency across the supply chain and really integrate sort of key values, I think, that were brought up in the discussion. And so, but ultimately, I agree. I think it's really sort of important to kind of bring farmers and the folks who are working in the agricultural section sort of into sort of this discussion as policies are being crafted, and they're a critical stakeholder.
Can I speak to that?
Sure.
So
Absolutely.
I was part of Harvest Home, my organization was part of the Nourish New York program, and I think it's an excellent program that came online very quickly and really helped to feed a lot of people. I mean, we worked with a partner organization and distributed over 200,000 pounds of food by partnering with organizations, because even though we had farmers markets, we could not distribute the free food at the farmers market. So we partner with organizations. But as a result of that, many of the farmers, which are family owned farms that we work with and are small producers in the region, were not able to take advantage of that program because many of them did not have the capacity to they didn't have the infrastructure for trucking and delivery into the city for the produce. And so only a limited number of farmers. And so a lot of the organizations that participated in the Nourish New York Farmers were larger farms and distributors who had the capacity to do that kind of transportation and labor intensive work. And so my point when I said about farmers is that a lot of the farming population is aging out. We are losing farms and we're losing farmers. And so unless we do something to significantly bolster that population and support retaining and enhancing and growing farms and giving them the ability to be able to continue to grow food and coordinate growth of food across our region. I'm not talking only in New York State, but also New Jersey, basically the eastern coast, that we won't be able to see a substantial increase in our food system that will be able to support our region in the midst of a pandemic. Because I think that a lot of the food that we're relying on is food that is being imported, and whether it is from other parts of the country or outside of the country, but our farm share is significantly being reduced over time because of farmers either aging out or losing their farms. And so that is part of the conversation that I would like to see incorporated into a lot of these food systems discussions that are usually left out of the conversation.
Thank you so much. I really appreciate that perspective. I'm going to try to get to a few more questions because we're getting close to our time. One that I mentioned on resources budgets, a couple of questions came in from the audience on just basically, I'm going to sum them up as this all sounds like it's going to cost a lot of money. Like how as you're creating these different policy ideas, are you thinking about the cost of policies and how the city can pay for these different programs?
So I'll stick my toe out and try to take on, this is a lot of money. I think that one of the things that we want to emphasize, especially when we talk about coordination, is that when you coordinate effectively across organizations, you actually have efficiencies that are gained in doing so. It can actually reduce costs when you're able to avoid duplication of efforts, right? So if we think about an individual just trying to, gain access to a couple of different food assistance programs, the kind of process of doing so can really be burdensome if they're having to fill out paperwork twice. And it can be burdensome for the agencies that have to kind of look at the same paperwork and kind of run it through different systems. So I think when we look at this over the long term, which is part of what we wanted to emphasize with some of our recommendations, that the savings, I think, will start to accrue once we see kind of effective implementation and uptake. In the short term, there might be an investment that's significant, and that's something that we have to put in context of the city's annual budget when it comes to kind of food assistance programs and the like. We're not necessarily tapping into the full power of the city's budget in that space. It's not a huge proportion of it, and so we're being, I think, we're already being relatively conservative in our spending. And so the kind of effort to amp that up a bit, especially to start up the process of integration, to start up the process of trying to educate and provide resources that are going to kind of discourage people from eating unhealthy foods, from standardizing the definition of unhealthy foods, from kind of doing all the things that we've talked about today. I think we'll start to see returns on that investment in kind of just the basic efficiencies, and then also the kind of larger effects on health. So that's what we also, I think, have to keep in mind over the long term. We're really talking about improving the health of the city's population by addressing these things like food security. So how to calculate that savings is something that we'll have to bring on, a team of economists and other folks to have a conversation about that. But I think we have to really be, comprehensive in how we think about the cost of not addressing these issues. And we have to be equally kind of broad in our thinking about the savings that accrue if we actually do tackle these problems. Part of the kind of calculation should always be, and has been for a long time, what happens if we don't do anything, right? The kind of cost associated with that. So I think we have to really take a number of different factors into consideration before we start thinking about dollars and cents, and keep in mind that there is room in the city's budget to kind of increase spending, especially in relation to the mayor's office of food policy, for example, and to kind of other efforts that already exist to try to create these synergies between agencies. So we're not starting from scratch in certain regards. So even the startup costs can be minimized in that regard. So I would just encourage broad thinking about the cost and consequence of not doing anything, and the benefit of some of the coordination efforts that we've been trying to promote. I hope someone has something else to add to that, because yeah.
I would love to. Sarah, +1, absolutely not dealing with our food problems is super expensive, right? And so that there's the flip side there. I think as the evaluator on the call, I would also be remiss if I didn't kind of bring up something that Gabrielle raised. So thank you for raising this. I think evaluating the implementation of programs and how they are achieving goals or not achieving goals is also, that's an opportunity to learn. That's an opportunity to understand how we can most effectively spend city dollars. We did a scoping review looking at response, city, state, and federal response to crises over the last 20 years. So how was the federal response to Hurricane Katrina or 9/11 implemented from a food policy perspective? What we learned is there's very, very little data about how those programs went. We maybe know how many people were reached, and sometimes not even then. And so I think really thinking about when we're implementing these programs, what can we learn from them? That all of that information can go into this equation as well, right? How can we be more effectively spending money? In not taking the opportunity to learn is a huge miss. So I just wanted to add that as well.
I also wanted to add to that, in the short term, there's $12 billion of federal funding coming into New York State from the American Rescue Plan Act, and that is a whole lot of money that could be deployed in a lot of really interesting ways. But in the longer term, how you pay for things is really just a matter of priority, right? One thing that COVID showed us is that there's no shortage of government funding to pay for things if we want government funding to pay for things. And that's what the budget justice movement was about too. It's like there is room in the city budget, but it depends on how we want to allocate that funding and what's a priority for us as a city. And if we determine that these issues are a priority, that we need to address them and pay for these really important programs to shore up our food system and make sure it's more resilient and make sure people are taken care of, then I think that we can do that. We just have to make sure that, that's a priority for the leadership of the city.
Absolutely. I have a question here that I think is a really interesting question. This audience member is saying, we know that we can't talk about food security without discussing wages, housing affordability, affordable childcare. Do you feel that focusing so much on emergency food and agencies in general without addressing general economic insecurity can effectively address food insecurity long term? So I would love to hear just from whoever wants to jump in a little bit about that balance between emergency food and, actually addressing these more systemic issues. Maritza,
Yeah.
if you want to share.
So that is one of the concerns that I have had in reading all of the policies. If you go back and look at why SNAP was created initially, it was really not created as a way to address food insecurity, but we have relied on it, consistently as a way of addressing food insecurity and ignoring all of those other issues. So if you ask someone, if you had a choice between enrolling in SNAP and earning a livable wage that would allow you to go to a supermarket and purchase whatever food, healthy food you needed, the answer would be, I would prefer to earn a livable wage so I didn't have to rely on SNAP. So I think that was one of the issues that when I was reading the policies, and I think we've gotten very comfortable with putting a Band-Aid on a gaping wound, which is food insecurity. And in my opinion, continuing to keep people dependent on a subsidy for healthy food is not a solution. It's a temporary solution to hopefully get you to whatever that next level is. The other thing that I wanted to say is that when I was reading some of the policies, I live in East Harlem, for example, and one of the concerns that we have all studied, and we've done supermarket studies, we've done bodega studies, there have been programs to increase supermarkets in low-income communities, and we still have a shortage of outlets of healthy food in low-income communities, whether it's a bodega or a supermarket. And for those areas where there are supermarkets, the cost of food in those areas is significantly higher. So I live in East Harlem, but if I go to East Harlem and I shop at my supermarket in East Harlem, the food costs me more than if I go to a supermarket on 86th Street to purchase that same food. And if you look at the demographic of East Harlem, most of the individuals in East Harlem are food insecure and also reliant on SNAP. So how do you fix that dichotomy of, yes, you have SNAP, but you're paying more for food in your area where you live versus someone who is not and is paying less? And so, yes, we need to figure out those little nuances in terms of how to move people from a place of dependency to independence.
I'd love to build on that if I can. You know, I agree with Maritza. I think one place where I thought that maybe these recommendations didn't go far enough is specifically calling out programs and policies that really could help increase ownership of food resources, food, businesses, urban agriculture businesses in BIPOC communities, so that they own those businesses, that there's wealth creation in those communities that were hardest hit by COVID. So, I would have loved to see recommendations for city funding to launch and support like worker-owned food cooperatives in low-income communities of color that really built off the mutual aid network set up during COVID, like Brooklyn Packers, Universe City, so many amazing efforts that were set up overnight to really meet an infrastructure need and a need to feed communities, setting, that basically turned into like this borough-based food hubs. The reality is that, we can't and should not continue to rely so heavily on the emergency food system to completely support all the food insecure people in New York. And we should really be focusing on addressing these underlying causes, keeping people out of poverty, making sure they're self-sufficient, making sure that they have wealth and that they can take care of their families and that they own businesses, and that, we are shortening these food pantry lines and that we're building food sovereignty in these neighborhoods that were hardest hit by COVID as a real learning from this.
Great.
Sorry.
Go ahead, Eliana.
I know we're running sort of on time, but just to add to what Gabrielle was saying, I think, the pandemic really highlighted the impact on food businesses, but particularly, smaller, independent, minority-owned, women-owned businesses were particularly hard hit. So I think, continuing to think about sort of kind of more focused support for, populations that were, kind of disproportionately impacted is going to be really important moving forward as well, and, should be at the forefront of the conversation and policy discussions as well.
Yeah, and just to add on to what Ileana is saying, which is perfect, and to kind of make sure we give this topic its just kind of space in this conversation. What we're talking about really is the social determinants of health, right? When we talk about where we need to place food security within this kind of, matrix of kind of factors that are driving, population health outcomes, and certainly poverty, kind of structural racism, other forms of isms that we've kind of really not had a chance to unpack in this conversation, but that are, very important, are going to be critical to any effort that is designed to address food security. We're going to have to address them hand in hand. It's another plug in some regards for agency integration, because you can't address social determinants of health in a silo. You have to get other agencies involved. It's transportation, it's housing, it's all kinds of supports that are going to be critical. And I think that, Maritza, to your point, we don't really unpack that, but I think that we try to kind of keep the focus narrow enough that we can get some things done and then continue to expand the conversation up to 2025. At least that's the hope and aspiration, but we definitely need to really focus on that integration of different factors at the outset to make any lasting change. Otherwise, everything is going to just be a Band-Aid in the short term.
Well, I think that's a great place to end. Thank you all so much for your work on the briefs, for your insights. Thank you to everyone in the audience for joining us this morning. It sounds like there's going to be a lot happening around food policy in New York over the next several years. And I think we really got a really valuable conversation started here this morning. And I appreciate everyone's contributions. Just a quick reminder that the briefs are available at nyfood2025.org under the policy briefs tab. And the organizers of the event will make a recording available soon for anyone who wants to revisit the discussion or share it with people who couldn't make it. So thank you all so much. Have a great day.
Thank you so much.
Thank you. Have a good day, everyone.
Bye.